Welcome back. The Trump administration has scrambled to address an article that appeared in NOTUS, that's News of the U.S., and that article found its MAHA Commission report misinterpreted a number of studies and cited others that don't exist. We're going to get to all that in a moment, but first, I'll turn briefly to President Biden, who spoke with reporters for the first time today since revealing his cancer diagnosis, and while talking to reporters, also addressed reports about his declining mental acuity while in office.
It's all a matter of taking a pill, one particular pill. And for the next 6 weeks, and then another one. And the expectation is we're going to be able to beat this. It's not in any organ. It's my bones are strong. I haven't penetrated, so I'm feeling good.
And there's also been a lot of discussion recently about your mental and physical capabilities while you were in office.
You can see that. I'm mentally incompetent, and I can't walk, and I could beat the hell out of both of them.
Well, do you want to reply to any of those reports, and also to the fact that there are some Democrats who are now questioning whether you should have run for re-election in the first place?
Why didn't they run against me then?
Do you have any regrets?
No, I don't have any regrets.
My colleague Alex Tin joins me now, as well as Dr. Céline Gounder, who joins us from our New York studio. Alex, I want to talk to you first about this Make America Healthy Again report and the errors within it. Please.
Well, look, the report was great because they essentially went through all the citations in this report released by the White House, and they found that some of those citations were either wrong, as you mentioned. They led to studies that essentially didn't exist. They found others were misinterpreted. And some of that echoes the things that we've heard from federal health officials who read the report, which they were frustrated, citations aside, that a lot of the conclusions in the report were wrong, and a lot of the things that they think are the real drivers of childhood chronic disease were omitted completely.
And that's a reference, Alex, you just made to the NOTUS report, looking at the Make America Healthy report released by the White House.
That's right.
Dr. Gounder, what is the damage that could be done in an event like this?
Well, this is a real breach of public trust. And coming from an administration that has said, look, we're going to be more transparent. We're going to follow the evidence. We're going to have gold standard science. And frankly, this is Orwellian doublespeak for sloppy pseudoscience. And when you do something like that, you are going to lose the public's trust, because this is not just sloppy. This is, quite frankly, dangerous when you're talking about making decisions for America's health.
And when the White House pushes back, Dr. Gounder, and says, okay, maybe there might have been some small technical problems, but the larger conclusions about these underlying chronic problems with adolescents and children in America are real, and that's what we should all focus on. How do you respond to that?
Well, the details matter. And yes, I think the broad proportion of the public would agree, yes, our adolescents, our young people are struggling with mental health issues. We need to address obesity and other chronic diseases. I don't think there's disagreement around that, but the details matter. And the fact that they don't seem to think those details matter, that they think it's not a big deal to make up citations, to make up references, that they are not interpreting some of these studies correctly, and so therefore arriving at incorrect conclusions as to what the next steps might be to address these problems, that is really, really concerning.
I'll play some sound from yesterday's White House briefing with the Press Secretary Caroline Leavitt on this very topic.
We have complete confidence in Secretary Kennedy and his team at HHS. I understand there were some formatting issues with the MAHA report that are being addressed, and the report will be updated, but it does not negate the substance of the report, which, as you know, is one of the most transformative health reports that has ever been released by the federal government and is backed on good science that has never been recognized by the federal government.
Can you talk about what tools or research goes into production of these kinds of reports? For instance, is it AI that's used to put together these reports now?
I can't speak to that. I would defer you to the Department of Health and Human Services. What I know is just what I told you.
Dr. Gounder, quickly evaluate that.
To say this is just about formatting errors, this is really scientific, not just sloppiness, but really unethical behavior. The National Academy of Medicine, for example, recently released guidelines for how we can appropriately use AI in health and medicine. But making up a baloney report about America's health using AI, and there are fingerprints of AI all over this report, that is just not ethical. It's not something the U.S. government should be engaging in.
Dr. Gounder, stand by. I want to talk to Alex Tin and also get your reference on An update on advisories about COVID vaccines for children, Alex.
Yeah, that's right. People might remember that earlier this week, Robert F. Kennedy Jr., he issued this announcement where he said he was going to make two major changes to the CDC's COVID vaccine recommendations. Number one, removing the recommendation for healthy kids to get vaccinated. And number two, removing the recommendation for pregnant women to get vaccinated. What we found out today is how the CDC is implementing that. They went all the way and indeed deleted the CDC's recommendation for pregnant women to get vaccinated. But they stopped short of what Kennedy asked for the children. Instead of completely deleting that recommendation, they changed it. They said that it's now essentially up to doctors and children and parents to use shared clinical decision-making, as they call it, to decide whether or not children who are healthy and have no underlying condition should be vaccinated. That matters because that distinction allows for continued requirements of health insurance to cover COVID vaccines for kids, at least for now.
Dr. Gounder, evaluate this in the real world.
Right. So I think what is, again, most concerning is not taking a scientific approach to this. So you have Kennedy, who is literally saying in a letter, I am making these decisions. And he is not a scientist. He is not a physician. He has no experience conducting a clinical trial or evaluating post-marketing data. He is a lawyer who has made a lot of money suing vaccine manufacturers. And, we've heard a lot about conflicts of interest. How is that not a conflict of interest? Somebody who's not a scientist, who's had money to gain from following some of these, advancing some of these policies. To me, this is, again, it's not an ethical process. It's not a transparent process.
And Alex, it may well create confusion for parents who are trying to evaluate how to proceed.
Yeah, that's right. I mean, look, Dr. Gounder mentioned it, right? There's a long established process that the CDC has set up and followed for decades for how is the correct way to update these, vaccine recommendations. It's a long process. It involves a number of experts, and it involves very boring hours-long meetings of experts, doctors, scientists, health officials to openly debate, discuss, and explain how they reached these updates to the vaccine recommendations. That didn't happen in this case. There was a video posted to social media by the health secretary that lasted about 90 seconds, and then a change that was made on the CDC's website. None of that meeting happened. And in fact, they were supposed to meet in June to do just that. It's unclear how that meeting can happen or how it's going to change now that the secretary has essentially circumvented that process.
Important perspective from Alex Tin and Dr. Céline Gounder in New York. Thank you both very, very much.